Back, it's time for Morning Rounds. Cleft and craniofacial conditions affect thousands of kids and adults across the country every single year.
And July is the month to spread awareness and prevention to this sometimes life-threatening condition. Joining us over video chat this morning to share how we can prevent these conditions is Dr. Tayebaly with Christie Clinic. Good morning, doctor. How you doing?
Good morning. How are you guys?
Doing well so far. Can you explain what's, awareness that we need to know about these conditions?
Yes, absolutely. So as you alluded to, thousands of Americans are affected by craniofacial deformities. They come in varying forms. So there are certain things such as cleft lip or cleft palate or combination of the two, and then more severe versions of this as well. So cleft lip is essentially where the tissue that forms the lip does not completely join prior to birth and during development, during a pregnancy. There's variation forms of this. Sometimes it's on one side of the lip, sometimes both sides of the lip, sometimes it's in the middle and extends from the lip up to the nose. Whereas cleft palate is where the roof of the mouth, or the palate of the mouth, also the tissue there does not join together completely as well during pregnancy. And then there can be variations of this as well and kind of more extensive versions of this deformity.
And doctor, we were actually talking earlier this morning about this topic, and we didn't realize that this actually could be prevented.
So there's definitely factors, that play into the formation of this. So there's definitely can be a genetic component. So for some women and some children that eventually will be affected by it, there is an aspect of it that's genetic, that's a little bit out of their control. However, there definitely are environmental factors and things that, in terms of, like, for instance, medications that mothers take during pregnancies that put them at higher risk for this. The kind of three big factors that are definitely preventable and things that, have implications in pregnancy in general beyond just these craniofacial deformities are smoking. Tobacco, as we know, has an impact on all aspects of health, but it definitely increases the risk in women who smoke cigarettes. Diabetes, especially if it's poorly controlled or uncontrolled, so also very important to have that optimized prior to conception and pregnancy. And then certain medications, particularly ones that we for seizure disorders or epilepsy, and that's why it's really also very important to kind of go through your medications, especially if you're on different ones prior to conception.
And doctor, can you explain what the surgical process is for this? If a child is born with a cleft palate, how do you go about correcting that?
Yes, absolutely. So again, depending on the extensiveness of the deformity itself, but typically within the first year of life, these are surgically repaired with specialists, and sometimes it's one surgery, sometimes it's multiple surgeries, but for the most part, majority of these can be definitely repaired and allow for the children to have, normal functioning in terms of breathing and eating and speech, but many of them need some assistance through that in terms of therapy throughout kind of their childhood, and that many times also need additional dental or orthodontic care, but it definitely is something that is treatable. Again, there's variations, but definitely something that we can manage.
And you mentioned those pre-existing conditions like diabetes or those medications as well. So, of course, it is extremely important to have that open line of communication with your doctor.
Absolutely. And that's why for women interested in getting pregnant, I think if you have any concerns about your family history, about your potential genetic history, about factors that may increase your risk, it's imperative to reach out to your provider, and we can have preconception counseling. Locally, we have genetic and maternal fetal medicine high-risk specialists locally that can help facilitate and counsel you appropriately.
And doctor, can you explain what kind of feeling that is to go through the surgery process and to see that reaction from the kiddos and from the parents and all the family members as well? What kind of feeling is that?
Oh, yeah, absolutely. It's incredible. I was fortunate to have some experience abroad working with this prior to going into medicine and seeing the life-changing impact of, so it seems sometimes so subtle, but it can impact someone's life dramatically, and definitely things that we can kind of help you out and help them transition and live as normal of a life as they can.
Doctor, thanks for bringing some awareness this morning. We appreciate your time.
Okay, great. Thank you so much for having me.
Thank you. And Adam has your forecast next. We'll be right back.